Hello everybody, I hope this finds you all well. It's really nice that we're getting a bit better weather now in Lanarkshire and moving out of the winter months. I'm going to talk today about our current numbers around COVID, as I usually do, and there's some good news in there. I'm going to talk a bit about our care homes team, and I'm going to talk about hospital visiting and the use of lateral flow testing for our staff, which has been expanded. The guidance has come in now for more staff to use lateral flow testing on a regular basis. So if I start with the numbers first of all, 42 new cases yesterday reported and 19 cases across the 3 hospitals now, and I think that's probably the lowest number we've seen for several months, going back to kind of January, February time. Well before that, I can't remember it being under 20 for several weeks now, so that's very good news. And probably the best news is that we now have no cases, no outbreaks within care homes, so that's absolutely fantastic news, and it's been a long time coming. We haven't really been in that position, I think, for months, so that's great news. In terms of vaccinations, 355,000 people have now had first and second doses, and 444,000 doses administered across Lanarkshire. We're currently focusing on second doses, so we're delivering about 7,000 a day at the moment and working through second doses in the older groups. So we've done the over 80s second doses now, but we're working through the over 75s and over 70s through local centres, and we are starting the under 50s first doses from next week, so that'll start from Monday, so that's a big step forward. So again, if you can encourage people to come and have their vaccination, I think it might be more of a struggle to persuade some of the younger people, so we're doing some specific communications around that to try and encourage them to come. So you and I might not see all these communications because they're on things like TikTok that I might not normally access, but the comms will be out there, coordinated through Scottish Government and with input from our local comms team as well. In terms of care homes, this is quite a landmark to get to a stage where we don't have any active outbreaks, and I just wanted to say that is something for our team to celebrate. The care homes team was established very rapidly about a year ago now, and under the leadership of Trudy Marshall and obviously with oversight from Eddie Docherty. But I just want to say thank you to some people personally. So Sharon Murray, Ashley Goodfellow, Maria Williamson, Michelle McConaughey, Lindsay Munro and Julie Burns have all been absolutely fantastic over the last 12 months in terms of the work that they have done to help the care homes with their infection control, to put in place improvement, to really work through some of the hygiene measures, and just to support the care homes in the delivery of their care during this difficult time. So I just want to say thank you to them formally for that effort. And far from resting on their laurels, they're back in care homes this week to see if they can actually do some further improvement work. So that's the kind of attitude that has got them through the last 12 months, and I'm sure that will continue. Hospital visiting starts again for patients, so a named person can have contact, which I think is hugely welcome, and the wards will be coordinating that as we speak to get that up and running again. So it's great news for families and relatives that patients can have a loved one to visit them consistently, which is great news. And finally, I just wanted to say a wee bit about lateral flow testing. So previously, lateral flow testing, the weekly tests that we do for staff, has been on front-facing staff. That's now been expanded to wider groups of staff, including people like myself who work in Kirklands and some of the other corporate services people, and also wider staff groups across our health and social care partnerships and within the local authorities as well. So I just wanted to say it's really important that you encourage people to take part in it. It's another way of us checking the spread of this virus and staying safe at work at all times. So I'll leave you there, but thank you very much for listening. Thank you.